Hey everybody, I'm Dr. Fox, and you're listening to The Natural Path. Hey everybody, I am just sitting in my car, about to go into Home Depot, but I just need to get this off my chest because I can't stop thinking about it. And if this can help any of you guys in any sort of way, or you can pass this information on to other people who might be in this situation with their little baby, that would be great, because it was really sad seeing what was going on with this little baby yesterday that I saw for the first time as a new patient. So this was an atopic dermatitis case / eczema case, and it was probably the most severe case I've ever seen in a pediatric patient before. Okay, so this is a 6-month, almost 7-month-year-old baby who had developed eczema around month 3. Which is quite interesting, and I have some theories on exactly why, but it was month 3. Now, upon taking the history, I was lucky because both mom and dad came to the visit, so I was actually able to ask about their skin history. And for those of you that don't know, eczema is known as an atopic condition, which means it's heritable. It's something that if one parent has it, definitely you have about a 25 to 50% chance of getting it, but if both parents have eczema, it's most likely that the child will develop it, potentially, depending on if the parents are aware before they have the baby how to prepare to avoid going through this with their newborn. So in atopic conditions, when you're a baby, it presents as eczema, and then as the little one progresses, it kind of morphs into other conditions over time. So they'll start to potentially develop asthma, seasonal allergies. All of these conditions are related to how the immune system's functioning. So it's a higher Th2 response. So Th2 is higher than Th1, which are two different arms of the immune system. So it's an overactive Th2, which creates the immune response that then causes these conditions. So genetically, when someone has eczema, there's this kind of imbalance already. And then often too, coupled with that, there's some level of skin barrier dysfunction, whether that is a genetic issue or it's related to malnutrition or lack of certain nutrients that are required to support skin barrier. And then obviously nutrients that support the immune system, because the immune system is what's kind of haywire in these cases. And also anything that will drive inflammation will also exacerbate this condition. So immune dysregulation, inflammation, micronutrient deficiencies, and genetics that kind of just create more of a skin barrier issue. Often people who have eczema, when it's more genetically related, they'll have a lot of other skin things pop up. So they have a lot of skin issues just in general, and that really does often come down to a barrier issue. So going back to the history of the parents, the mom has history of eczema, and she had said that before seeing me, she actually started to cut out dairy, eggs, as per suggestions, just from, people around her who are like, this worked for me, you should try this. But when I took her history and asked about her eczema and if she had ever identified kind of what triggered hers, it was actually citrus. And citrus is something that is not on most people's radars. But I'll tell you that in pediatrics, citrus is a huge thing when it comes to sensitivities and skin issues. Now, the dad, he had actually had anaphylactic testing when he was in his 20s, because he was dealing with severe seasonal allergies. He'd also had eczema when he was younger. So obviously his had morphed into more the seasonal allergy side of things. So he went to an immunologist, and it was confirmed at that time actually that he had a rice sensitivity. I think it was egg, the other one, and then dust was a huge thing for him. So even now in his adulthood, he's chronically vacuuming. He says, I vacuum every day, because he knows how sensitive he is just to dust exposure. So that was kind of the two parents' history, which is really valuable when you're dealing with a ped who we can't really do a ton of testing on yet. Now, though he could have some of these wirings from his dad, which knowing the dust piece was very important, what we're really actually looking at when you're dealing with an exclusively breastfed baby is what is the mom's immune system doing? Because he's literally drinking what's happening in her body. So we actually had to really shift gears and focus on what is she putting in her body? What is she being exposed to, and addressing things with her, so then he wasn't getting passed on these inflammatory, reactive, immune dysregulating things through the breast milk. So definitely that's kind of what we started with, while also giving him some gentle support for his tummy. Now, another important piece of this mom's history is that she had hyperemesis gravidarum, where she was like nauseous and vomiting literally for the first 4 months of her pregnancy. So she couldn't take supplementation, she couldn't keep food down. She was pretty much severely malnourished in her pregnancy. And then even when she kind of did get in a better space with that, she got put on a medication. Still, she I think failed to remember, or maybe her support team didn't suggest her then try to do some repletion. And at minimum, we take prenatals obviously for a reason, because you're shunting all your nutrients to your baby. But she didn't even have that. So there was a lot of malnourishment actually going into delivery and then into breastfeeding. And for those of you that don't know, breastfeeding depletes you even more than building a baby in pregnancy does. So that was a huge piece that we had to address as well. Now, circling that back to baby eczema, is that if we don't have the micronutrients to support the skin barrier, we're not going to have a very healthy skin barrier. So someone who already has this genetic predisposition and then probably doesn't have the nutrition to support healing in general, it's going to put huge barriers to healing the skin overall. So again, going back to mom, just making sure that we did address the diet and kind of what we needed to increase for her to then pass on to him to help with his healing from the inside out. So for those of you that don't know the nutrients that are required to help with skin barrier function, so vitamin A, a lot of people know about this more from like beauty and cosmetics, that it helps with healthy skin turnover. Vitamin C, definitely important for collagen production. Zinc is really important for wound healing. Vitamin E, a really important antioxidant. You definitely want to get creams that help, or that have ceramide in it, because that's a huge piece of like the barrier and its functioning. Collagen, obviously, that's important as well. And then omegas, so they're very hydrating, very lubricating. And in eczema, because the skin is weeping and it's letting out water, basically we need to hydrate it as much as we can. So those are kind of the core pieces that you want to be looking at when we're rebuilding skin and eczema. So the big question, what did we do? So yeah, we got the mom on some nutritives, so some supportive supplements, addressed some dietary things that were going on, got her on an omega or prenatal, vitamin D. We did a probiotic as well. And then, unfortunately, and I hate to say this, but because we don't know specifically what's going on with what foods are causing what, I did have to temporarily put her on a more strict diet to take out the more obvious things that we know were her triggers, her husband's triggers, to give baby a little break. And hopefully that will help put out the fire. But also in the meantime, I gave her a lab rec so we can do food sensitivities just to make sure we're not missing anything. But I did say, like, to the blood, get your blood drawn right away, so we can get accurate results and then start taking these inflammatory. And just so you know, I do not love doing any sort of restriction for a pregnant lady, for a breastfeeding lady, for a small kid. It's not where I usually start, or I try to avoid at all costs if I can, but still kind of get the results we want. But this poor little boy, he had eczema, like his entire face was crusty and red and inflamed. And so when there's severe things happening and extreme thing happening, we have to do more extreme things. And I just made sure that before they left my office, we had a really good plan, so she didn't feel like she was starving. They had meals set out that they could make that were accessible, so no one's starving. But yeah, extreme cases, sometimes we do unfortunately have to do extreme things. Now, how did they land in my office is that they went and saw medical doctors. and basically said it's obvious this baby has some sort of what they suspected to be an environmental allergy. They didn't even consider foods. Gave him the steroid cream, and even the steroid cream, honestly, given how bad it is, it hasn't been managing it. They've been dealing with this for 3 months and haven't gotten a huge amount of support. So that's what they were offered through their GP, and honestly, their GP was just doing what they know. So I'm not going to say it was wrong or bad, because we have to do something to put out the fire, definitely. So all hands on deck, but hopefully, and I will report back in a month to let you know where we landed with this.